Burning when you pee could mean you have a urine infection or an STD. So how do you tell the difference between an infection which is sexually transmitted versus an infection in the urine? I'm going to cover that in this video. Hey guys, I'm Dr. Lane from Adelaide, South Australia, coming to you with fun and factual health education. Now before I get into this video, if you like what you see, consider subscribing to my channel. And look, if you've got any health questions that you're too embarrassed to ask, I'm always looking for future topics for videos, so chuck it in the comments down below, or even consider sending me a personal message on Instagram. Okay, so what's the difference between a UTI and an STI? The fundamental difference is where that infection is localized. In a urinary tract infection, the bacteria invades the urinary tract. That is basically any of the organs that are responsible for the production or storage of urine, so kidneys, bladder, all the tubing in between. A sexually transmitted infection, on the other hand, targets reproductive organs. So in males, that includes testicles, prostate glands, and all the tubes that carry sperm and semen out of the penis when you ejaculate. So that means if you look at the male anatomy, the urethra serves a dual function. It obviously allows urine to pass through from the bladder, but also sperm through from the testicles. And this is the reason why burning when you pee is both a symptom in urinary tract and sexually transmitted infections. The urethra is full of pain receptors, and in a UTI, those pain receptors are triggered often by the urine itself, which can be quite acidic when there's a lot of bacteria in it. In a sexually transmitted infection, often the bacteria infects the urethra itself, and so the lining of the urethra becomes very inflamed. So that's basically the difference, but now how do you know which one you have? Well, it comes down to context. So we often have this saying in medicine, common things happen commonly. And in a young male who has no history of urinary tract infections or any kidney disease, a UTI is actually relatively uncommon, whereas sexually transmitted infections are very common in young people, particularly if they're having sex without condoms. So if a young guy comes in to see me with symptoms of burning and a history of having unprotected sex, say a week ago, I'd be thinking of an STI until proven otherwise. Now, the next point of difference between a UTI and an STI is the symptoms. Yes, they both can cause burning when you pee, but there are other symptoms that are more specific to one or the other. For example, a UTI will commonly cause cloudy or even bloody urine, whereas an STI rarely will. Penile discharge, on the other hand, or testicular pain, is almost certainly going to be an STI rather than a UTI. And UTIs don't typically cause itching or irritation on the penis. As for fever, well, you can definitely get a temperature with a urinary tract infection, particularly if it spreads to the kidneys. With a sexually transmitted infection, however, it's less likely, particularly in males. But the only definitive way to really tell the difference between a UTI and an STI is to get tested. And to do that, you're probably going to have to visit a doctor like me. But the good news is we can normally start some treatment immediately based on our clinical suspicion. So you don't necessarily have to wait until the test results get back until you feel some relief. Both UTIs and STIs can be treated with antibiotics in most cases, but the type of antibiotic we use will be different with the two. Now, if you're interested in finding out more about the symptoms associated with different sexually transmitted infections, I've got lots of videos on this channel, so have a look. Chuck me a message or post a comment down below. I'm always looking for new ideas to make video content. Stay healthy, guys. I'll see you soon.